Did you know that severely itchy skin during pregnancy can be very dangerous? It might actually be a symptom of a liver disorder, and if it's left untreated, it could risk the health of the fetus. Good for Utah's Robin Seville explains.
I had no idea what cholestasis was until I was pregnant with my daughter. With her, I had one day of really bad itching about 32 weeks, and it started in the middle of the night.
For Anderson, the itching became so severe that it was impacting her entire life. She suspected it was a condition known as cholestasis of pregnancy, or ICP.
In the U.S., it's typically quoted as being about 0.5%, but honestly, I think it's been much less than that in my typical patient population.
Although rare, ICP is a condition in the liver where bile production is slowed or stopped. This results in production of bile salts in the bloodstream. This causes itching for the mother, but can cause serious complications for the baby, including premature labor, fetal distress, and stillbirth.
The really concerning thing, though, the one that keeps doctors and patients up at night, is the risk for fetal demise, and that is an increased risk for babies of mothers with cholestasis in the pregnancy.
For Anderson, she believes ICP was something she inherited from her mother.
Nobody really knows for sure. I mean, there's probably some component of this that's related to genetic predispositions.
Anderson is happy that she was diagnosed early.
I had this strange feeling that everything was going to be okay. I hated the itching, and it was keeping me up at night.
ICP often leads to early delivery.
You know, and even if you end up being delivered at 37 or 38 weeks, which is going to be typical in a patient with cholestasis of pregnancy, that's early enough that it can cause difficulties for the babies.
While I wasn't thrilled about having to be induced early, I was grateful that, measures were being taken that she would be okay.
When does it go from itching to something more serious?
If you take an antihistamine, for example, like loratadine or Benadryl, and the itching doesn't go away, you should probably talk to your doctor.
If you have itching that is keeping you up at night, and if you cannot find no relief for it, then talk to your doctor.
In South Jordan, Robin Seville, Good for Utah.
If you'd like more information about ICP and an upcoming ICP event, we have a link on our website. You can check out the story at goodforutah.com.